Hello, fellow parents and caregivers. Welcome back to our channel. Today, we're diving into a topic that's near and dear to many parents' hearts: breastfeeding. Specifically, we'll discuss the often debated question of when to stop breastfeeding your baby. Breastfeeding is a beautiful and natural way to nourish your baby, providing essential nutrients, antibodies, and bonding moments. However, there comes a time in every breastfeeding journey when the question arises: when is the right time to stop? Let's start with the recommendations from the World Health Organization, WHO. The WHO recommends exclusive breastfeeding for the first 6 months of life, followed by continued breastfeeding, along with appropriate complementary foods up to 2 years of age or beyond. This recommendation is based on extensive research showing the numerous health benefits of breastfeeding for both the baby and the mother. However, it's important to remember that these are guidelines, and every baby and mother is unique. So let's explore some factors that may influence the decision to stop breastfeeding. One crucial factor to consider is your baby's readiness to wean. While some babies may naturally lose interest in breastfeeding as they grow older, others may continue to nurse for comfort and nourishment. Signs that your baby may be ready to wean include showing more interest in solid foods, becoming easily distracted during breastfeeding sessions, or self-weaning by nursing less frequently. It's essential to listen to your baby's cues and respect their individual pace. Rushing the weaning process can be stressful for both you and your baby, so take it slow and follow their lead. Another crucial factor to consider is the mother's health and lifestyle. Breastfeeding can be physically demanding, and some mothers may face challenges such as low milk supply, mastitis, or breastfeeding-related pain. Additionally, returning to work or other commitments may make breastfeeding more challenging. If breastfeeding becomes too difficult or stressful for the mother, it's perfectly okay to consider alternative feeding methods. Remember, a happy and healthy mother is essential for the well-being of the whole family. Emotional readiness is another essential aspect of the weaning process. Breastfeeding creates a unique bond between mother and baby, and weaning can be an emotional experience for both parties. Some mothers may feel a sense of loss or sadness when they stop breastfeeding, while others may feel relieved or empowered. It's essential to acknowledge and honor these emotions, whatever they may be. Talking to other mothers or a healthcare provider can provide valuable support during this transition. Lastly, cultural and societal factors may influence the decision to stop breastfeeding. In some cultures, extended breastfeeding is the norm, while in others, there may be pressure to wean earlier. It's essential to consider your own values and beliefs, as well as those of your community, when making decisions about breastfeeding. Ultimately, the decision of when to stop breastfeeding is a deeply personal one that should be based on the unique needs and circumstances of both the mother and the baby. There is no one-size-fits-all answer, and what works for one family may not work for another. Before we conclude, let's take a moment to explore the benefits of extended breastfeeding. While some may choose to wean their babies at the recommended 6-month mark, others may opt to continue breastfeeding for an extended period. Extended breastfeeding, which refers to breastfeeding beyond 1 year of age, offers several advantages. Firstly, extended breastfeeding provides continued immune support for your growing toddler. Breast milk contains antibodies and other immune-boosting factors that help protect against infections and diseases. This can be especially beneficial as your child explores the world and encounters new germs. Secondly, extended breastfeeding promotes optimal nutrition and growth. While solid foods play an increasingly important role in your child's diet as they grow older, breast milk continues to offer a unique combination of nutrients and hydration that can complement their diet. Thirdly, extended breastfeeding fosters emotional security and comfort. The bond between mother and child established through breastfeeding remains strong, providing a source of comfort and reassurance for your toddler during times of stress or uncertainty. Lastly, extended breastfeeding supports cognitive and emotional development. The close physical and emotional connection experienced during breastfeeding promotes brain development and helps your child develop a sense of trust and security. In conclusion, whether you choose to breastfeed exclusively for 6 months, continue breastfeeding beyond 1 year, or wean earlier, what matters most is that you and your baby are happy and healthy. Trust your instincts, listen to your baby, and seek support when needed. Remember, You're doing an incredible job, and whatever decision you make, it's the right one for you and your family. Thank you for joining us today. If you found this video helpful, don't forget to give it a thumbs up and subscribe to our channel for more parenting tips and advice. Until next time, take care and happy parenting.